So patients were screened for HCV in the opioid treatment program. Um, and the screening involved both an antibody and an RNA. And once those who were RNA positive, they would be seen by a advanced practice provider, a physician, a PA or nurse practitioner who was at the opioid treatment program along with them in the same room, along with a case manager. So there was actually, who's not pictured here, there was actually a case manager who was employed by the study, who was external to the opioid treatment program, but became then integrated into the workflows. The three individuals would then be in the room with the patient, who would then undergo the telemedicine evaluation with a provider. And then at the end of the session, medications were ordered, and then they were dispensed with methadone. So people actually come for methadone dosing. So we were able to co-distribute both the methadone and the hepatitis C medications, with take-homes provided when people didn't appear in the study. And so in the pilot study that I referred to, 93% were cured for their hepatitis C, and 95% recommended this treatment modality over in-person referral. So we saw and these were not a priori findings, so we have to be cautious about their interpretation in a randomized trial. We saw that Hispanic females in the telemedicine arm were almost universally cured, while in the referral arm, there were very few who were cured. And it's not an English proficiency issue, but for whatever reason, the convenience of and perhaps the environment in the OTP was very conducive to their being cured. Similarly, amongst rural patients who came from rural counties, and it was only 15% of the population, but very similar. Very few achieved a sustained response in the referral arm, whereas almost everybody in the facilitated telemedicine arm was cured of their Hep C in those two populations. The two major limitations are, one, the limited number of sites. We had 12 sites throughout the state of New York, and the fact that it was conducted in one state, New York State, which is where methadone was discovered and was first approved and tested in the 60s. So maybe the reimbursement for methadone in New York State is somewhat more generous than other states. That being said, some of the areas in which we're proceeding are to look at other states, California in particular, for future implementation. And in fact, I was on a call earlier today with a colleague who's implemented a similar model for Hep C on a mobile van. And we were speaking with one of the former administrators at one of the sites who reiterated the comments that I made to you about the value from the opioid treatment program point of view.